The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. My name is Julie Bates. Welcome to the webinar. I'm just going to go ahead and do this introduction while people are rolling in. We're excited to have Jody Barnett and Abigail Newby-Q present on the new Alaska Behavioral Risk Factor Surveillance System Data Center today. This presentation is part of a series of webinars provided by the Alaska Division of Public Health Section of Chronic Disease Prevention and Health Promotion. This webinar series was created to provide a way for us to talk about our projects and explore ways we can work together. Next slide, please. So before we start, there are a few housekeeping items to go over. If you're listening by phone, please keep it on mute. Please don't put this call on hold. If you receive a call, hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation, followed by 10 minutes of questions and answers. A recording of today's webinar will be sent to all participants, and the slides will be made available online soon, probably in about a week. Next slide. Audio for this webinar will come through your computer or telephone. Please hold questions until the end of the presentation, unless you have a technical difficulty hearing or seeing the webinar. To ask any type of question, you can type it into the questions on the control panel. We can also unmute you, and you can ask your question using either the microphone on your computer or with your phone if you called it. Just raise your hand by clicking on the hand button. Excuse me. Thank you for joining us today. Now I'll turn it over to Jody and Abigail.
Yeah, hello everyone, and welcome to our webinar today. Thanks for being here. We'll go over, again, I guess the topic of the webinar is an introduction to the Data Center for Alaska's Behavioral Risk Factor Surveillance System. And again, my name is Jody Barnett, and I've been the BRFSS coordinator here in Alaska since 2020, which is when I joined this section. I'll go ahead and turn it to Abigail.
Hi, everyone. Thank you guys so much for being here. My name is Abigail Newby-Q, and I'm the Public Health Data Analyst for the BRFSS Data Center and BRFSS Survey. And I've been with BRFSS for about 1.5 years now.
Yeah. I will just jump on in just to go over our agenda for our short webinar today. So I'll provide a little bit of a background about the Alaska BRFSS program for those of you that don't know much about it. A bit about the data collected by BRFSS, and then how BRFSS data can be used, including a demonstration by Abigail in our new Alaska BRFSS Data Center. And then we'll have plenty of time for questions if there are any. Okay. So the Behavioral Risk Factor Surveillance System is a national system of annual health-related telephone surveys driven by the Centers for Disease Control and Prevention. And data are collected in all 50 states and 3 territories, and Alaska has participated since 1991. So it's a very long-standing surveillance system both nationally and across states. Funding, TA, and guidance is provided by the CDC to ensure consistency and coordination across states. States collect their own data, which are used for their own health priorities, and states also contribute to the national data set, which is managed by the CDC. So the survey asks adults about their health, as well as behaviors that could affect their health, and data is used to guide programs and ensure effective use of public health resources. So BRFSS data is used to generate annual prevalence estimates. So prevalence estimates are defined as the proportion of individuals in a population who have a health condition during a defined period of time, and it's usually expressed as a percentage. And here are a couple examples from BRFSS. So in 2020, 19% of Alaska adults reported binge drinking in the past 30 days. And then in 2021, 26% of Alaska adults were diagnosed with high cholesterol. So our ability to generate prevalence estimates is generally accomplished through random digit dialing. So telephone numbers are chosen at random within defined geographic areas, and then data are weighted to be representative of the US and Alaska population. Next slide. So this is a graph of our annual sample size here in Alaska from 2011 to 2021. And so the bars represent the number of completed surveys each year. And you can see that that does vary a little bit year by year, and it largely depends on the funding that we do have available. So the minimum required by the CDC is 2,500. And again, the CDC is generally interested in state level estimates, but data users in Alaska are often more interested in regional estimates, which require a larger sample size than required by the CDC. So we rely on numerous funding sources to go above the minimum sample size required. And I think in 2021, our sample size was above 5,000, which is great, and we're hoping to maintain that level over the next several years. But it did require funding from about 17 different partners, so it does require a lot of support from a lot of different funding sources and partners here in Alaska. About 80% of completed surveys come from cell phones, and about the other 20% come from landline cell phones, or landline telephones, sorry, which has been a bit of a change over the past several years. This used to be 100% conducted over landline telephones until about 2011 when cell phone data collection was introduced, and now is the predominant way we collect data. Next slide. So the survey has two primary components. We have what we call the CDC required core, which is about 18 minutes in length. Questions in these modules are developed, tested, and required of all states. We can't omit or change questions, and they are required for the national data set. So there's some standardization across all states in the country. But it does allow a little bit of wiggle room. So once, again, the core has been met, there's about 4 to 5 minutes, at least for Alaska, for state-chosen content. So that can be optional CDC modules. So these are modules developed by the CDC. They're also included in the national data set, and they can't be changed in any way, shape, or form. So they can be either deep dives into some of the core module topics, or they can be entirely new topics altogether. And I think there were 33 optional modules in 2023 that we could choose from. And then we have the option just to include state-specific questions. So if none of the optional modules are suitable for our needs, we can add our own questions, which we have done. So they aren't designed by the CDC, and they are only included in our data set. They're not included in the national data set. So one example from 2022 were 3 traumatic brain injury questions. Again, those had never been included on the Alaska BRFSS before. There were no optional CDC modules that addressed that topic. And so we ended up developing our own questions that year. Next slide. So here's a list of different topics collected by BRFSS. This is for the core survey. The topics in bold are currently on the 2023 survey. And so I know there's a lot of information on this, but just to give you an idea of the kind of information and topics included on BRFSS that are required. So some of the core modules are asked every year, while others are asked every 2, 3, or 4 years to keep the survey at a reasonable length. If we included everything every year, the survey would probably be about an hour in length, and people wouldn't finish the survey and they would probably drop off. There we go. Next slide. Okay, so the Alaska BRFSS health data can be explored geographically and by different population groups. So the Alaska BRFSS allows for data to be explored by 7 public health regions, 12 tribal health organization regions, and 11 behavioral health regions. So you can explore the data by population groups such as sex, age, and level of education to look at differences between groups, understand who may be at higher risk for chronic diseases or other health conditions. And again, all of those efforts help to guide and evaluate public health efforts here in Alaska. Next slide. So now I want to talk a little bit about the Alaska BRFSS Data Center, which Abigail is going to provide a demonstration on here in just a minute. This data center was shared with the public at the end of 2022, so it's been in the making for about a year and a half. So rather than submitting a data request, it gives organizations, programs, and individuals direct access to summary data online. It's publicly available and allows users to run queries specific to their needs. So again, users can look at specific regions of interest, health topics of interest, or maybe years of data that they're most interested in. It was developed in partnership with ANTHC's Alaska Native Epidemiology Center. Both organizations are heavy users of BRFSS data and are very invested in making data accessible. So we'll continue to add new data every year as we collect more data and expand indicators over time too. So now I'm going to turn it over to Abigail to finish out our webinar here.
Awesome, thanks Jody. So I'm going to talk about now a little bit about how the BRFSS data can be used. I'm going to walk us through a few examples of how we can use the data center to answer public health questions. I'm going to use smoking for this example, but we currently have over 60 different public health indicators already included in the data center. And like Jody mentioned, we're going to be continuously adding new years of data, but we're also going to be adding additional indicators. So I'm going to walk us through what % of Alaska adults currently smoke, what % of Alaska adults currently smoke broken out by age group, what does the trend look like over time for the % of Alaska women who smoke, and what % of Alaska adults smoke in each public health region. And as we walk through these examples, we'll review some of the key tabs and information that are included in the data center, which includes our user agreement, some information about Alaska BRFSS, and our Explore Data tab, which is really the bulk of the data center, where we have indicators, so we can create graphs and estimates for public health indicators for the state and by select demographics. We have a trend tab, where we can look at graphs and estimates for public health indicators over time. And we have a geographic tab, where we can create maps and estimates for public health indicators by the specific Alaska regions that Jody described earlier. I'm going to take us through some examples. I want to say these are pre-recorded videos, so I apologize that the resolution is not quite as high as I would like. Right. Okay, so this is the landing page for the data center. Before moving forward, you'll have to accept the user agreement. It provides some information about the data, lets you know that by using the data, you're agreeing not to try and identify individual subjects, how to cite the data if you use it, and to let the BRFSS program know about any publications or products that you create that use the data. Finally, there's some contact information, which is also included on the main page of the data center. Hopefully this is actually, oh, that was not actually playing. Let's see if I can move forward. The video should show us that we click agree in just a moment, but. All right, great. Okay, so the first tab I want to direct you to is the About Alaska BRFSS tab. This provides more detailed information about the data, available indicators, and information about the BRFSS survey itself and how the data were analyzed for this. Next, we'll move on to the Explore Data tab. We use the box on the left here to select our indicator of interest. So to find data on smoking, we're going to scroll down to substance use. So next we can select a specific indicator, and we want to know about current cigarette use. We can get more information about this indicator by clicking on the About This Indicator button. It gives us a description, the years that are available in the data center, how the question was asked on the original survey, and whether the question was developed by the state of Alaska or by the CDC. So now to get our answer. In 2019 to 2021, 18.3% of Alaska adults reported that they currently smoke cigarettes. If we're only interested in 1 year of data, we can go up to the Selected Years option and uncheck 2019 and 2020. So now we can see that in 2021, 17.4% of Alaska adults reported that they currently smoke cigarettes. This information is displayed in both a table and a bar chart. If you're interested in downloading the bar chart, you can go to Plot Options and click Download. We can also add 95% confidence intervals to the bar chart. These provide a measure of how much an estimate might vary due to chance. Lastly, we can also download the table into an Excel spreadsheet if we'd like. right, so now what if we're interested in looking at what percent of Alaska adults currently smoke by specific age groups? We start where we left off with our first question and go to stratify by demographics and select age group. We currently have a 4-category age group available in the data center. Once we select, we see both the table and the figure update. So we can see that in 2021, 15.9% of Alaska adults ages 18 to 34 reported current cigarette smoking. 21.6% of Alaska adults ages 35 to 49 reported smoking. Just like before, we can download this table into an Excel spreadsheet. Maybe for your program, you're only interested in adults ages 65 and older. In this case, we can select just this age group, which will update both our figure and our table. Or maybe we're interested in all adults ages 50 and older. We have the ability to create groups if we select multiple options. So in this situation, the groups we did select will show up as selected in the table and the figure, and the groups we did not select, in this case ages 18 to 49, will show up as the remainder. So we can see 16.5% of Alaska adults report current cigarette smoking in the age group of interest, and then 18.4% of Alaska adults ages 18 to 49 report current cigarette smoking. So often we're interested in understanding whether health indicators change over time. So to look at this, we can use the Trend tab in the data center. When we first select the tab, it's showing us the percent of Alaska adults who do not smoke in that upper yellow line, and the percent of Alaska adults who do smoke in the lower blue line. Since we're interested in the trend for adults who do smoke, we'll filter the indicator response level so that we only see the yes responses. These changes are reflected in both the table and the figure. So just like the indicator tab, we can download both the table and the trend plot. And before we filtered, the no responses were also in that table. Since we're interested in the trend among women, we can stratify by sex. So initially, both male and female responses show in the figure, but we can select a demographic level to filter so that we only see the female yes responses. And this helps us dig down to our question of interest. So here we can see that the trend for the percent of Alaska women who smoke looks fairly stable between 2015 and 2021, and does not appear to be either increasing or decreasing. So for our last example, we're going to look at data by public health region. So to do this, we'll click on the geographic tab. If it's playing. There we go. So the page looks blank until we select our response level to map. In this case, we're choosing yes because we're interested in the percent of Alaska adults who said yes, they currently smoke cigarettes. And once we make our selection, a map pops up. The map shows us the first 3 years of data, but just like the indicator tab, we can make it so that we only see data for 2021. So just like in our other tabs, all of the data is down in the table below as well. If we hover over a region of the map, it will show us the name of the region, the response we selected, the percent who report smoking, and the 95% confidence interval. In 2021, the northern region had the highest percent of adults who smoked, 34.9%. Anchorage had the lowest percent of adults who smoke, 14.3%. So I selected public health regions because they're most commonly used by the Division of Public Health. But we also have tribal health regions and behavioral health regions included here. We can click on the description of geographic regions. Let's see, to find out more about which boroughs and census areas are in each region. There we go. we can expand and we can scroll down and we can see a full list of all of them. So we can also compare a specific region to the rest of the state. So for example, I live and work in Juneau, and I might want to map smoking rates for Southeast compared to the rest of the state. So here I'll select my regional level, and the map will update to show the selected region versus the rest of the state. So that's being called remainder in the table below. And so here I can see that 19.9% of adults in Southeast smoke compared to 17.2% in the rest of Alaska. And just like the other tabs, we can download both the figure, so the map that's showing here, and the table. And just because that was a little bit fuzzy, I know with the resolution, I just wanted to show you a screenshot of the upper tab of the data center here. So those blue arrows are showing the About Alaska BRFSS tab and our Explore Data tab. And then once you click on that Explore Data, you'll have access to the indicator, to the trend, and the geographic regions tab. You can explore them as you will. That kind of wraps up our demonstration here. So we'd love to take some questions from you all.
Thank you, you guys. I'll keep an eye on questions coming in. Just put your questions in the question box or in the chat, either one. I'll keep an eye on both places. And I'm putting links to the data center as well as the contacts for Jody and Abigail into the chat if you would like to contact them about data.
Yeah, I will say while we're kind of waiting for the chat comments to come through, if the data center is still expanding and growing, if there's anything in there that does not meet your needs, please don't hesitate to reach out to us at BRFSS@alaska.gov, and we're happy to fulfill a data request for you for the needs that you have.
Yeah, and for current years of data, we have 2015 through 2021 right now. We will be adding in 2013 and 2014 very soon. Our previous year of data usually comes out late summer, early fall. So that's the earliest that 2022 data would be added into the data center.
I'm not seeing any questions coming in, but I will say if you think of something and you'd like to contact Jody or Abigail, please do so. They're more than happy to answer any questions you have. And then I did link to the BRFSS website as well as directly to the data center in the chat. So if you want to explore on your own, please do so and get back to us. Let us know if you have any questions. Thank you, you guys. I guess we can end the webinar early.
Okay.
Thanks for presenting today.
Thanks, everyone.
Yeah, thank you, Julie, and thanks everyone for coming to watch this.